Did you know that pregnancy is the first stress test for the heart and that hormones can affect your heart health? Dr. Erica Oberman is the co-founder of the Comprehensive Women's Menopause Center here at UCLA. Today, I'm going to sit down with both Dr. Oberman and Dr. Rajita Patil to talk about their dedication to women's health in general. I hope you enjoy my conversation with Dr. Oberman and Dr. Patil. You both and Dr. Brittany Davis co-founded the Comprehensive Menopause Center here at UCLA. What can you tell us about the center?
The center is really, the purpose and the mission is to provide comprehensive menopause care that really helps to optimize their short-term and long-term life, because we know that menopause affects the short term, but we also know that it affects the long term. And so it's really comprehensive menopause care, but also individualized to the patient.
Tell me, Dr. Oberman, how did you get involved in women in menopause?
It had a huge knowledge gap when it came to knowing about menopause and how to provide really good care for women who were having so many different symptoms. And so I went ahead and got certified myself. And fortuitously at the same time, Dr. Patil was putting together this idea for the Comprehensive Menopause Program here at UCLA. And so we connected, and it's just exactly what I wanted to do with everything that I was learning.
When a patient comes to the Menopause Center, what should they expect?
Well, they should expect a pretty in-depth visit. Prior to seeing us, they do fill out a questionnaire that talks about symptoms and different organ systems and how they're experiencing menopause individually. And then we go through each of those questionnaires to make sure that we are touching on everything that they are concerned with, and then we provide them with the resources, not just written resources for them to know, but referrals to doctors that they may need.
Is it almost as if you are quarterbacks for women as they're going through menopause?
In a way, we're sort of like a mini primary care provider for menopause. That's kind of a women, it's like a very specific niche of providing comprehensive health at this specific time frame. And so we collaborate actually with over 30 specialists within UCLA. So in the areas of bone and cognition and mental health and sleep and heart, because we know that all of these areas are really hit by the changes in the hormones that are happening at the time. And so we want to make sure that when we do identify patients that are in need of a little bit more specialized expertise, that we have a direct way to interact with those specialists and for them to receive the care.
Do you have any tips for women who gain weight during menopause?
Yes, lots of tips. It's a super frustrating side effect of what is going on with them, and it can also affect their health. But really to doing a deep dive in diet and exercise, if they're incorporating a healthy lifestyle, alcohol, cigarettes, smoking, all of these things can contribute to weight gain. It also can contribute to their risk factors for cardiovascular disease. We also have weight management programs here at UCLA that incorporate nutritionists, they incorporate weight loss drugs and other things for them to use so that they can help fight that during this time if that's important to them.
You know, it's important to really understand that the average patient or person going through menopause is going to gain that 5 to 10 pounds really quickly. And I think that's the biggest thing that we see is a patient will come and say, you know, why have I gained this 5 to 10 pounds and I have done nothing different? And the first thing to tell them is, you're right, you know, this happens. And it happens not only because our metabolism is slowing down, but it really does happen because we start to lose muscle pretty quickly due to the biological changes that are happening from the hormone level. And there's also a redistribution of the fat in the body. And so it tends to sort of sit in the middle. And so number one, just explaining that, and then also focusing sort of on the muscle building and the resistance training, not only for the bone support and the health, but really because we know muscle burns more fat and also it just burns calories. And so just really focusing more of the exercise on muscle building.
I've been told that pregnancy is the first stress test for the heart. What does that mean?
During pregnancy, we often see certain diseases that come out in women that may affect them later on in life, gestational diabetes being one of them, as well as hypertensive diseases in pregnancy. These diseases can give us a clue as to what may happen to them and their risk later on.
You know, there's been really good data to show that it is your true first stress test, and we see that when women do have low birth weight, gestational diabetes, or hypertensive disorders in pregnancy, those same patients go on to have cardiovascular disease in the future when compared to those that don't have them. And the more factors you have, the more synergy there is between those factors and the more risk they have in the future. I think what's interesting is that a quarter of the population will probably have one of these adverse pregnancy outcomes. When you think about how many people are having babies and how many have more than one baby and at different ages in their life, it's a really astounding number and definitely needs to be taken seriously, not only just from a menopause standpoint, but honestly, even after pregnancy is over. It's very important for the obstetricians to recognize these factors in the postpartum period and to have almost like transition to the primary care providers with the information that, hey, look, their blood pressures are still not normal, and this is no longer related to pregnancy. And so they need closer eyes.
What exactly is preeclampsia?
So preeclampsia is when you have high blood pressures in pregnancy and you have protein in your urine. You can also have other markers of the disease in your liver, in your kidneys, in your brain, and mostly in your vasculature.
We don't really understand completely why preeclampsia happens, but we think it stems from something released from the placenta. Because we know that once the placenta delivers, that preeclampsia over time resolves. There's much to be studied in this area still, but we do know that it's something that's sort of released from the placenta that causes the blood vessels in the body to be somewhat leaky or damaged for that period of time.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.